Hello, my name is Kelly Webster, and I'd like to welcome you to my TED Talk, Ideas Worth Spreading. Today, I want to tell you a little story about when I graduated college for the first time 10 years ago. My dad, he worked as an oil executive for 35 years, and the biggest piece of advice that he gave me was don't bring me problems, bring me solutions when working, and I feel like that was a very valuable piece of information, and it's very applicable to what I'm going to talk to you guys about today. So what you're looking at right here is a word map, and it is a program that's used where when you ask people to describe something, and it's how often that word pops up. So today we're going to talk about eating disorders, and here are the words that come up most often. You'll see anorexia, restriction, dieting, eating, weight, disorder, just a ton of different words. But the one that we're really going to focus on today is treatment. So we're going to talk about uh, how to make treatment more affordable because there's just such an issue with those with eating disorders getting proper treatment, being able to afford it, and insurance covering it. So I wanted to start with a personal story. I had an eating disorder in my 20s. This is a picture of me at probably my lowest point, and I ran a marathon somehow. I had anorexia. I had a job in corporate marketing. I'd been in the workforce for about 5 years, and just mental health issues and stuff kind of led to me developing an eating disorder, and I never felt that I was really sick enough or anything. I mean, my job was pretty decent. I got paid pretty adequately. I had decent health insurance. But what really was a barrier even for me was how was I going to afford it? Because insurance really wouldn't cover it that much, even though I had, pretty decent health insurance. That really was a barrier of care, even for somebody that's, considerably well off like me. So, even myself going through this, I saw that there is just really this gap that needs to be filled, and I really think that advocating and creating a policy where insurance companies cover eating disorders is extremely important. So here are some quick important facts. 24 million people in the United States have eating disorders, but only 1 in every 10 seek out treatment. And inpatient treatment, the cost per month is $30,000. That's just outrageous. And a lot of people, if they are the ones that do seek out treatment, end up having to pay that out of pocket, which is absolutely insane. So, eating disorders, they are the second deadliest mental health illness right behind opioid addiction. And I'm sure that most of you have heard of different kinds of just anorexia or bulimia, but there's also binge eating disorder, ARFID, pica, rumination, and eating disorder not otherwise specified. These are labeled out in the DSM-5, which is the Diagnostic and Statistical Manual of Mental Health Disorders, the 5th edition, and that's what for most mental health stuff that's the treatment criteria and diagnosis, and so currently we're going off of the 5th edition. And I have a helpful little chart here just kind of to give you more information on eating disorders, what the difference between anorexia, bulimia, and binge eating. And then you'll look at, the mean ages, which you'll see that, anorexia and bulimia tend to affect about college age students, but then binge eating disorder, you're looking at, 25, which is, people out in the workforce. So then when it comes to treatment, there are 2 main different kinds of treatment, and that is inpatient and outpatient treatment. Outpatient treatment is when you are seeing, like a therapist, dietitian, eating disorder doctor, stuff like that. You're not necessarily in a program that goes on all day. For inpatient treatment, that's a little different. That actually impedes on your daily life. A lot of people have to take leave from work, or like take time off from school. It can be inpatient as in residential, where you live at the treatment center, or you're just doing 7, 8 hours a day. So here's kind of like a level of care. So there's outpatient treatment, intensive outpatient, partial hospitalization, residential inpatient. So it's a little confusing. The intensive outpatient is, or the outpatient, intensive outpatient are for like the most medically stable people. So, they're not experiencing heart issues. You still may have some, weight issues, but it's nothing that is needed for, to be in the hospital. And partial hospitalization does sound a little bit scarier than it is. Partial hospitalization is just, the 7 to 8 hours in a treatment center. So, you go home at night, but you have most of your meals and then all of your therapy, dietetic appointments. And then residential and inpatient. Inpatient at the hospital, that is the least medically stable, and that is the most severe. So, why is this important? So cost. So the MHPAE, or the Mental Health Parity and Addiction Equity Act, that is for insurance companies. They cannot put limits on the coverage for any mental health treatments. However, the problem is that for eating disorders, the diagnosis often doesn't meet the criteria that's set by the insurance companies to qualify for coverage. So that's a major issue, because a lot of insurance companies have very specific rules that they go by for coverage, which can be, a lot of them have weight loss, which a lot of eating disorders don't have weight loss. There's also lack of access to care. It's really hard to find eating disorder specialists in a lot of just normal cities, which even in a place like Houston, Texas, where I live, we do have a few, but I mean there's like 2 for how absolutely large this city is. You'd think there would be more. And then there's also stigma. I can say from personal experience, calling my insurance company to talk to them about getting my treatment covered, I told them it was for an eating disorder, and the lady literally on the phone said, "Oh, honey, just come to my house and I'll help you eat more." Like, that's not okay. That's like, that is how people who really do need treatment are being met with, and just feeling the stigma of like, oh, well, I guess I'm not like really that sick, or this really isn't a problem. So what does that mean? What can we do about this? So what I've created is the eating disorder treatment insurance coverage. And it would require insurance companies to be unable to deny coverage of treatment when an insurance claim is submitted by a treatment team member or provider. And this includes physicians, dietitians, therapists, psychologists, and other treatment team members. Insurance companies would be unable to deny for any type of treatment, even from all the way from just outpatient all the way up to inpatient hospitalization. So this would be run by the Department of Health and Human Services. The department's mission is to enhance health and well-being of Americans by providing for effective health and human services. The subset of the DHHS that would be most in charge of this is the SAMHSA, which stands for the Substance Abuse and Mental Health Services Administration. So there's 2 types of insurance that most people have, private and public. Private insurance would be like Blue Cross Blue Shield, Aetna, what normal employers would offer. So eating disorder treatment would be qualified and would show up as in-network. And the patient's responsibility would be to pay no more than $30 per visit or day. And it would vary depending on the plan, but that's kind of the maximum that we would set. For public insurance, you're looking at stuff like the Affordable Care Act, Medicare, Medicaid, and CHIP. For the budget for this would kind of go off of state and federal funding. and also the Medicaid federal medical assistance percentage. Grants would also be given, and that would be application based and awarded to programs and treatment centers from the Office of Financial Advisory Services. So that would all be under the SAMHSA for federal funding. So when you look at budget cost, after I spent my time in corporate America, I learned that money saved is more important than money spent. When you approach these subjects with money, you want to frame it in a way that people are saving money. So the biggest issues financially for the government is loss of productivity and extensive absenteeism. Loss of productivity meaning, they're not able to keep up with their workload, stuff like that, and also extensive absenteeism, having to miss a lot of work for being sick or not feeling well. So the loss of productivity as of right now has cost $48.6 billion. And absenteeism has cost $6.4 billion. That's an insane amount of money. And this could be cut back if, treatment was covered, more people were getting treatment instead of just sitting there and, trying to deal with their eating disorder on their own because they're too afraid to get help and can't afford it. So how would we go about evaluating this program? We would send out surveys to treatment centers for the patients to complete, and that would include questions about what type of insurance they're using, which is public or private, and how the coverage is being handled. For minors, the parents would be the ones that would fill it out for them. Surveys would be administered by the DHHS, and they'll be sent twice a year after the policy is put into place. The DHHS and the SAMHSA will both collect the information that's provided annually. The information collected will include patient numbers, so how many patients, the diagnosis, treatment received, and insurance coverage information. The insurance coverage information will include what the patient was responsible for, as well as the insurance company, what they paid. So this will be done every 3 years to assess the adherence to the policy. So the surveys to the patients or the parents of the patients will be done twice a year, and then we'll do surveys to the entire, the treatment centers, the providers, to get more HIPAA compliant background information, and that'll be done for 3 years following to assess the compliance with the policy and to, checks and balances on the insurance companies and that they are following this policy. So, to wrap this all up, I wanted to, as somebody who's suffered from an eating disorder, if you or someone you know is suffering from an eating disorder, you're not alone. Please visit the nationaleatingdisorders.org for more information and help. And I've always wanted to say this, but thank you for coming to my TED Talk.